this is Heidi Palpreder with International Focus Magazine, coming to you from Houston, Texas, with the director of the Houston Health Department. Mr. Williams, would you mind introducing yourself and telling us a little bit about your background with Houston?
Yes, I'm Stephen Williams, the director of the Houston Health Department. I've been here for about 16 and a half years. Before coming to Houston, I was in Austin and Travis County, and before that, I was in Phoenix. Actually changed careers some time ago in Phoenix. My practice background was actually in behavioral health, but I jumped over to public health in the middle 80s, actually.
Okay. And I wanted to ask you, so what's happening right now? I mean, everybody's, been at, there's been different reports about what's happening with the vaccine supply in Houston. And I know that that's really the first question on everyone's mind that's trying to get the vaccine is what is happening with the Houston Health Department and the vaccine availability?
Okay, well, first of all, we're one of several entities within the city of Houston or within our region that is a recipient of vaccine. As a health department, we're actually a safety net provider for vaccine. The major part of our job actually involves coordinating and planning to ensure that there's adequate vaccine distribution throughout the city and also ensure that there are access points where people who might be challenged to get the vaccine can actually access it. But most folks focus on that safety net part of our role, which really involves our putting shots in arms. We have been getting vaccine. It started, I think, last week before last. But totally, we haven't gotten, well, actually, I've started to say 13,000 doses, but we got a shipment this morning. And so totally, we probably will have about 21,000 doses. But
and that was for the entire city of Houston or in the Houston Health Department or?
That was for the Houston Health Department.
Okay.
That's why I wanted to put it in context because there are a variety of providers, especially hospitals, that have gotten vaccine. And as a matter of fact, they got vaccine before we did. And the reason they got vaccine before we did is because, of course, the priority population 1A is healthcare workers that are caring for COVID patients or folks that are working or residents of long-term care facilities, nursing homes, EMS providers.
Well, I know that it's been actually, in my opinion, I think it's everybody's been working very hard, and I think that we have been quite successful in distributing the doses that we have, and I know that many people are just waiting to see. What I did want to ask you about is there's so many people that are still hesitant in the community that basically they don't trust it, they don't know which vaccine to trust because they say there's 5 of them, and I would just ask you, what would you say to the community that's feeling hesitant and really just not unsure about coming in to get a vaccine?
Well, there are 2 things that I would say. The first is that people are hesitant because they're thinking that this vaccine was developed in a matter of months. That's not accurate. This methodology has been used for the last 15 years or so, not necessarily for the development of vaccine, but for the development of treatments for cancer. And so there was some experience with this. The other thing is that there are no shortcuts. People think that, 4 months they had to cut some. No, all of the trials that vaccine would have normally gone through, it's gone through. And so when you put all of that together, you'll see that it's really the usual time frame for the development of vaccine. And if you look at who's taken the vaccine already, I took the vaccine, my first dose on Monday. You'll notice that there are very few people that are having any kind of adverse reactions to the vaccine. But that's normal. A small percentage of people have reactions to vaccine. So.
Very good points. Thank you so much for filling people in because you're right. People do think that it just happened overnight, but every scientist in the world has been working on this collectively to make it happen. And so it's really a great feat of science.
Yes, it is. And there are more vaccines that are coming out. And they're going to go through the same process. safety is foremost in the development process. Uh, so therefore, I think that people need to just trust the science in this case.
Thank you for reminding us of that, and thank you for taking a moment to speak to me today. Was there anything else that you wanted? One thing I wanted to ask was, what is the best information? Where is the best place for people to find information on where to get a vaccine and what they can do?
For Houston, I would say go to our website, houstonhealth.org, and it'll have a number of links that you can click on depending on what information you're seeking. And, you know, there is vaccine, yes, there are 2 out that are being used within the United States, and hopefully there will be more soon. I would encourage people to be patient, but I'll also encourage people to stay the course. What I mean by that is we have been promoting wearing of masks, we have been promoting social distancing, hand washing, we've been promoting taking tests. We should not let our guard up. We should just keep guard down, excuse me. We should just stay the course. Even though there is a vaccine, we're not out of the woods yet.
Yes, a very good reminder that until more people get vaccinated and we actually get to the other side of this, is that you can still catch the virus, and that we must stay diligent with our procedures.
Absolutely.